My name is Dr. Ron Nicholson. I'm a clinical psychologist, and today I'm going to talk to you about exposure scripts, what they are, how to make them, and the best way to use them. So first off, what is an exposure? When you have OCD, part of your brain is overactive, specifically the part that wants to warn you about things. So it will send you intrusive thoughts, or the obsessions, as a way to warn you about something. It might want to warn you that you're contaminated and you're going to get someone sick, or that if you hold a knife, you might hurt someone, or that you might not love your partner enough and you're actually in the wrong relationship. Whatever, it can be anything. So you might do something to reduce the anxiety, the compulsion, like wash your hands, or get rid of all the knives in your home, or try to figure out if you actually are in the right relationship. The evidence-based gold standard treatment for OCD is exposure and response prevention, or ERP, which means that we go towards the things that your brain wants to warn you about, the exposures, and we stop doing the compulsions, response prevention. And when you think about doing exposures, we tend to think about doing something physically. If you have contamination OCD, you might touch something dirty. If you have harm OCD, you might hold a knife. But what if your OCD is focused on something intangible, like a thought or a question? The question could be, what if I'm so distracted by my own blinking for the rest of my life? What if I am in the wrong relationship? How do I know if I'm actually gay or straight? Well, when OCD wants to warn you about something intangible, like a thought or a question, we often use what's called an exposure script. Exposure scripts work just like a regular exposure. You go towards the thing that your brain wants to warn you about, so that we can then display irrelevance, which is a big fancy way of saying that we show the OCD through our actions that this is not important. When the OCD worries about something tangible, like contamination OCD, we can intentionally go towards the scary contaminated thing. When your brain is worried about a question or an idea, well, then we can intentionally have the thought, ask the question, and go towards the scary idea. An exposure script is a small note that you write, preferably with your therapist, that elevates your anxiety by going towards the thoughts that your OCD wants to warn you about. This might mean accepting that you might in fact be distracted for the rest of your life by your own blinking, or that maybe you are in the wrong relationship, or that you'll never know for sure if you're gay or straight or somewhere in between. Exposure scripts are great because you can do them several times a day wherever you are. You probably can't step away from work 10 times a day to go touch an actual dumpster, but you can read your script. This helps you challenge your anxiety multiple times a day and in various contexts of your life, at home, at work, at school, wherever you go. And doing this multiple times a day and in different contexts helps you to better treat your OCD. So, how do you write an exposure script? There are two parts to every exposure script. First, the intrusive thought. When you're in therapy, what you'll do is you will write down the various different intrusive thoughts that your brain will warn you about. You write them all down. Then, you take the thoughts and you decide how much each of them bothers you, like on a scale of let's say 1 to 10. And you take that thought, that intrusive thought, you write that down. That's the first part of your script. And you might start with the ones that are a little bit easier and work your way up to the ones that are harder. So long as you keep challenging yourself, you're doing good. That's the first part. Verbatim, word for word, what your intrusive thoughts are that your brain wants to warn you about. The second part is you include the compulsion. This part's important. You include in there what your brain has been telling you that you should do to remove the anxiety. For instance, if it's contamination, you would say, my hands are dirty and covered with germs, the intrusive thought. I should probably go and wash my hands again, the compulsion. You include both of those, and that is your script. The benefit of this is that you can look at your script multiple times a day in multiple contexts. You want to beat your brain to the punch and show it before it even has the opportunity to warn you that you are not afraid of this. You are willing to have that thought or ask that question. That teaches your brain that this is not something that we're going to act on or react to. we are going to display irrelevance. This is one of the best things that I have found for treating OCD. For when OCD focuses on things that are intangible, like a thought, but also even when OCD focuses on things that are a bit more tangible, often there will be a core fear underneath it that is intangible, a thought. Like, if I contaminate things, that means that someone is going to get hurt and it's my responsibility. So we can usually use exposure scripts with other tangible exposures in our OCD treatment. That's what an exposure script is. Thank you so much for listening. Have a great day.